The name of this slide is Breastfeeding Outside of the Home. I am Raymonda A. Adams. I'm a certified lactation consultant and a doula, and this is being presented to you by the UB Maternal and Child Health Program. What we'll discuss today is breastfeeding in public, pumping and milk storage, and going back to work. And now I'll hide the screen so that you can focus on the slides. Breastfeeding in public. Why you might feel discouraged. Breastfeeding in public may make others uncomfortable, and it may even make you uncomfortable. Here are some words of encouragement. Breastfeeding benefits you and your baby. You are meeting all of your baby's nutritional needs. You'll carry a lighter diaper bag. The laws are on your side, and you can do it. So be very proud of your commitment. Here are some tips for breastfeeding outside. You can use a special breastfeeding blanket or cover-up and wear clothes that allow easier access to your breasts. You can breastfeed in a sling, and you can also go and breastfeed in a woman's lounge or a dressing room. Practice your public breastfeeding techniques at home first so you get some level of comfort. You can use a breastfeeding blanket and breastfeed with male family members being around. Remember, practice makes perfect. The do's. Do know your legal rights. Do what's comfortable to you. Do plan ahead. And do focus on your baby and yourself. Also, do have confidence. The don'ts. Don't pack unnecessary items such as nursing pillows with you. Don't sit in a place where baby will get distracted. Do not nurse in a bathroom. Don't be aggressive towards criticisms, and try not to take up too much space. Pumping and milk storage. The methods of pumping or expressing milk are hand expression, a manual pump, or automatic electric breast pumps. When you're hand expressing breast milk, you compress your breast to remove the milk by hands. The tools that are required, your hands. This is suitable for mothers who are rarely away from their baby, and the cost is free. A manual pump. Operate and hand-hold device to pump milk. Tools required are the pump and your hands. This is suitable for mothers who are occasionally away from their baby, and the cost is somewhere between $30 and $50. Automatic electric breast pumps. Automatic pumping device that runs on battery or plugs. The required tools are the electric device. This is suitable for working moms or moms that are going back to school and mothers that want an easier method to pump milk. The cost of an electric breast pump is usually between $150 and $250, but most are covered by health insurance. Some tips on pumping. Wash your hands and the equipment used for pumping. Remove milk according to the baby's normal feeding schedule. Use baby-related items to help on milk letdown, such as baby photos, clothes, crying audio tapes, and pump in a relaxing and quiet setting. Storage of breast milk. Breast milk should always be stored in glass or hard BPS-free plastic bottles with tight-fitting lids or milk storage bags. Absolutely do not store milk in bottle liners or other similar plastic bags. Label milk storage containers with dates and baby's name. Gently swirl the container of milk if it is separated. Do not shake. And refrigerate or freeze milk right after it is expressed. Here are some milk storage guidelines. This has come from your Guides to Breastfeeding by Healthy Resources and Service Administration in the Office of Women's Health. For the countertop, You can store breast milk up to 3 to 4 hours is best. Up to 6 to 8 hours is okay for very clean express milk. Know that containers should be covered and kept as cool as possible. Covering the container with a clean, cool towel may keep the milk cooler. Throw out any leftover milk within 1 to 2 hours after the baby is finished feeding. For a small cooler with a blue ice pack, the temperature should be around 59 degrees Fahrenheit. You can keep milk there for about 24 hours. Keep the ice packs in contact with milk containers at all times and limit opening the cooler bags. In your refrigerator should be 39 degrees Fahrenheit or colder, and breast milk can be stored in the refrigerator for up to 72 hours. Up to 8 days is okay for very clean expressed milk. Store milk in the back of the main body of the refrigerator. Freezers, 24 degrees Fahrenheit or colder. You can store milk in a freezer for up to 6 months. Up to 12 months is okay if milk is stored at 0 degrees or colder. Store milk towards the back of the freezer where temperature is more constant. Milk stored at 0 degrees Fahrenheit or colder is safe for longer durations, but the quality of the milk might not be as high. Thawing and warming up milk. Thaw and use the oldest stored milk first. Breast milk does not have to be served warm. Thaw frozen milk overnight in a refrigerator and warm the milk by placing container under warm running water or in a container of warm water. Do not ever microwave milk. Swirl the milk after it thaws. Do not shake. And test milk temperature by dropping some on the inner wrist. Discard leftover milk. Do not refreeze. Thawed milk storage guide. Thawed breast milk at room temperature between 60 and 85 degrees Fahrenheit. For 1 to 2 hours is best. Up to 3 to 4 hours is okay. Thawed breast milk in the refrigerator at the temperatures of 39 degrees Fahrenheit or colder is good for about 24 hours. And thawed breast milk, absolutely do not refreeze. Going back to work. How to ease with the transition. The best thing we can say is for you to plan ahead. During your pregnancy, join breastfeeding support groups. Talk with mothers who plan to or are breastfeeding while working. Talk with your supervisor about breastfeeding plans. Discuss adjustments on work schedules. Research to see if your workplace provides a lactation program, and find private areas in your workplace where you feel comfortable pumping milk. And remember, never pump or breastfeed in a bathroom. During your maternity leave, take at least 6 weeks off to help recover from childbirth and settle into a good feeding routine. Practice milk pumping and expression. Adjust baby to drinking from a bottle. Research your daycare options. Tell family and daycare providers about your decision to breastfeed. Ask for help from a doctor or a lactation consultant if needed. And towards the end, develop a breastfeeding routine that works best for you and the baby. Back to work. Continue to negotiate with work supervisors for a flexible work schedule. Breastfeed in daycare right after reuniting with your baby, and consult with a lactation consultant for tips if needed. The federal break time for nursing mothers law requires that employers covered by the Fair Labor Standards Act provide basic accommodations for breastfeeding mothers while they are at work. These accommodations include time for women to express milk and a private space that is not a bathroom each time they need to pump. Learn more about what is required of employers and what employees need to know. Here are some tips for expressing at work. Invest in a quality electric breast pump. Discuss with work supervisors for a private place to express milk, such as an office with a door, a conference room, a little used closet, or storage room. Express your milk during times that you normally would feed your baby. Label, name and date.